Hello, YouTubers, and welcome to Informative News and Talk. I want to run a story by you today in reference to the coronavirus. I know in recent weeks here you've heard about the many deaths in the state of New York. We also see and hear about the deaths that are in the South, like in places like Louisiana. And it's pretty much alarming. I think New York had over 600 deaths reported in one day, and Louisiana have increasing deaths. But anyway, there's a doctor. Her name is Dr. Ann Bukasat. She's a renowned doctor from the state of Montana. She has been working with these type of cases similar to coronavirus and doing death certificates for over 30 years. And what she has reported that some of these numbers that have been reported by the CDC, the Center for Disease Control and Prevention, are unreliable and pretty much inaccurate. She said in many cases, doctors have been pretty much taking deaths from other cases or other related sicknesses and just pretty much pinning people with coronavirus when that's not really the case sometimes. Pretty much creating a situation of fear mongering. So I'm going to let you listen to what she's saying, and we're going to come back and talk about this.
Positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list they list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us. I hope I was able to make my point. The real number of COVID-19 deaths are not what most people are told and what they then think. How many people have actually died from COVID-19 is anyone's guess. Again, God only knows. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. Thank you.
So what you heard right there from the video, Dr. Ann Bukasat has stated that most death certificates are not accurate. If a doctor hasn't done a pretty much an autopsy or did some type of detailed diagnosis to truly determine the cause of death, they wouldn't truly know about what caused the death. But lately here, a lot of these deaths because of the coronavirus have been labeled coronavirus, although it may not be. Now, the CDC, who's collecting these stats from the states, it just brings up the question, who's checking the checker? When these stats or these death numbers come from the state case numbers and it goes to the CDC, who's responsible for ensuring that these numbers are accurate? So now we're hearing about all of these deaths, like I mentioned earlier. Can you really, trust that these numbers are right? From what we heard from the good doctor, they're not. So we truly don't know how many deaths there are from coronavirus. So that's alarming. So who's going to really get this, I guess, the accurate information here? So we know, we as the people of the United States, pretty much around the world, know what is the true case of coronavirus. Are people just dying from the regular flu? Are they just dying from other sicknesses and they're just being labeled with coronaviruses? That's something that to be really to be found out here soon, because right now it is unclear if all these deaths are related to the coronavirus. So you tell me what you think about this. There's been a lot of conspiracy theory going around stating that this coronavirus is not true. It makes you think. I'm not saying that it is or not. I don't know. But when you hear a medical professional say things like that about the numbers are not being accurate, you're wondering, are they trying to create a situation of fear mongering? If they are, why? So you let me know what in the comment blocks what you feel about this situation. Take care.